These are the MRI brain images, axial sections, T2 weighted images. I can see a hyperintense signals is seen. Multiple T2 hyperintense signals are noted in the bilateral cerebral hemispheres, in the right frontal lobe and left parietal lobe, and bilateral uh, posterior parietal regions, and also in the bilateral occipital regions. These are predominantly in the subcortical white matter. The lesion in the left parietal region is seen to be crossing the midline involving the splenium of the corpus callosum. Um, no infratentorial lesion is noted in the brainstem or in the cerebellum. In the cerebellum, I think I can see a lesion in the cerebellum in the left cerebellar hemisphere. However, there is no hydrocephalus noted, no midline shift is seen, no significant cerebral herniation is noted. Um, the bilateral orbits appears unremarkable, but the bilateral orbit, I think there is some kinking in the orbital nerve on
Ignore
the
that.
right side. Okay, okay.
Mhm.
I will like to see any other sequence flare if available.
You got it. There you go.
Okay. There is some same signal abnormalities in the previously described areas. The basal ganglia and thalami appears unremarkable. I will like to see the post-contrast images if available.
So far, what comes to your mind?
I'm thinking on the lines of some white matter abnormalities, but there is it is crossing the midline, but sparing the basal ganglia and periventricular regions. My differentials would include any demyelinating disease. If the patient is young, I would be thinking of any acute demyelinating encephalomyelitis,
The
or
patient is 60-year-old.
if the patient is 60 years old, I would be thinking of any. It's a multifocal process,
Mm-hmm.
and it is hyperintense on T2. Otherwise, I will be thinking of CNS lymphoma, but it would be T2 iso or hypointense. Other
Okay.
differential, yeah, could be of
Good enough. I'll show you the post-contrast images. But before that, I want you to have a look at the diffusion restriction and describe the pattern of restriction. Chilanji, please start scrolling.
okay. All right, so I can see that there is a diffusion restriction noted in the lesions in the posterior parietal lobe, in the occipital lobe also, and in the splenium of corpus callosum, showing significant diffusion restriction. However, some of the lesions do not show diffusion restriction. So,
What kind of diffusion restriction is this? Can you further characterize? I agree there is diffusion restriction, but where exactly?
in the region of splenium of corpus callosum,
ठीक
it
है
is
यहाँ पे लेकिन
less.
बाकी बाकी lesions देखें.
There is peripheral diffusion restriction. It is
So
hypointense on the
predominantly peripheral diffusion restriction.
peripheral ring, and yes, peripheral
Hmm.
diffusion restriction.
Could these lesions be abscesses?
Um, yes, one of the differential can be, but less likely because there is no significant vasogenic edema,
There was
and
some vasogenic edema on T2
yes,
around
there
these
was
lesions.
some.
Hmm.
Yes, other differential could be of
The answer would be no. These can't be abscesses. You tell me
yes,
why.
it cannot be abscesses because it was not well defined, and abscesses show central diffusion restriction rather than
That
peripheral
is
diffusion restriction.
the correct answer.
Yes,
If these lesions were abscesses, they would be showing central diffusion
central
restriction
diffusion restriction because of the necrotic. Yeah,
rather than
because of the
peripheral diffusion restriction. Now we
because of
come to
proteinaceous.
the point of discussing the lesions which cross the midline or involve the
Yes,
corpus callosum. Can you
yeah.
name a few?
Yes, sure. Lymphoma, glioblastoma multiforme, or it can be tumor-effective multiple sclerosis. Other include metastatic
Which
deposits.
differential do you think is the most likely in this case?
I think lymphoma would be more likely because it is causing diffusion restriction.
Again, a lymphoma should show a central or a
T2
homogeneous,
hypointense, yeah.
a more of a geographic restriction rather than a well-defined peripheral diffusion
Yes.
restriction.
So it is more likely in a demyelinating disease, which is
Mm-hmm,
showing this type of diffusion restriction and also
mm-hmm,
crossing the midline.
mm-hmm.
And
You are,
juxtacortical lesions and also the infratentorial lesions. And
ठीक है.
some are showing diffusion restriction, some are not showing diffusion restriction,
There you go.
suggesting
You asked for a post-contrast sequence.
in space and time, dissemination in space and time. Okay. On the post-contrast images, there is ring enhancement. Peripheral ring enhancement is noted. And the ring is thin on the medial aspect and thick on the lateral aspect. Some of them showing open ring enhancement and some of the lesions are non-enhancing.
And some of the lesions are showing punctate central enhancement too.
Yes,
Some of the lesions are showing open ring enhancement. Some are
yes,
showing
and
a
there
peripheral enhancement. Some, like the one here,
here, yes,
is also showing central arc-like or punctate enhancement too. Few other lesions are also showing punctate enhancement.
over here as well, yes.
So, considering all these findings that you have told me, I think you have done really well on this case. What do you think is the most likely differential possibility?
Um, I think differential would be of demyelinating disease such as
The patient is
cumulative
a
multiple.
60-year-old male.
Okay,
Demyelinating would be a top differential.
yes. Metastasis cannot also be ruled out because in an elderly patient, but that again would have a significant post-contrast enhancement.
And
Other indications,
a lot of vasogenic edema.
a lot of vasogenic edema, yes.
Hmm.
Um,
So
can it be
you
multifocal GBM?
no.
No. Okay.
GBM should typically show central necrosis with peripheral thick,
Yes.
irregular, lobulated enhancement. Why are you hesitant in calling it you have called it a demyelinating disease process, but why are you so hesitant about it?
Yes, because the features are only in the favor of demyelinating और किसी में नहीं है आर एफ फिटोरेक्स.
हाँ, तो फिर इसमें मसला क्या है?
Yes. So
ठीक
it
है,
is
डी
demyelinating disorder
हाँ,
and disseminated in time and space. So more likely, I think they're in favor of multiple
demyelinating में
sclerosis.
क्या? अब what is more likely in this age group?
Um, in an elderly patient,
यहाँ पे देखें ना, ये incomplete open ring type
rings.
enhancement है. Few are showing central punctate और arc like enhancement. ठीक है, ये भी इसकी incomplete ring enhancement है. ठीक है, peripheral diffusion restriction है. There are only two
Multiple
differentials in this case.
sclerosis,
And
multiple sclerosis, and acute demyelinating.
हाँ, तो आपने ये कहा था कि if the patient is young, this could be acute ADEM. ठीक है,
Yes. Hmm.
acute disseminated encephalomyelitis. ठीक है, but the patient is 60-year-old, तो उसमें ADEM नहीं हो सकता.
Less likely, yeah. If there's any history of viral infection,
The
then
patient did have a viral infection few about 2 weeks ago and now presented with
okay.
disorientation, fever, seizure. This is a case of acute disseminated encephalomyelitis. ठीक
All
है,
right.
what would you do next in this patient?
Next, I will refer the patient to the neurology department for neurological consultation for management. This
Mm-hmm.
patient needs conservative management and follow-up imaging
कंजर्वेटिव
because
मैनेजमेंट में क्या करते हैं इनका टिपिकली?
steroids.
इम्यूनो स्टेरॉइड्स देते हैं, इम्यूनोसप्रेसिव थेरेपी देते
Yes.
हैं, प्लाज्मा एक्सचेंज हो सकता है. थैंक
Mm-hmm.
यू वेरी
And
मच
then
डॉक्टर
follow-up
साहब,
imaging.
ब्रिलियंटली डन, वेरी वेल डन. थैंक यू.
Thank you, sir.